Hello everyone, it's Dr. H. Today I'm going to talk about cognitive behavior therapy, how it works. We talked about CBT, cognitive behavior therapy, last time. We introduced negative thoughts. And we introduced ABC model. We'll continue today. A depressed person may think things, may predict things in a non-realistic manner. With CBT or cognitive behavior therapy, it can help the person to get around those automatic negative thoughts. We all know negative things can and do happen in our life. These are not avoidable. However, when we are in a disturbed state of mind, we may base our prediction on a biased view of our current situation. In other words, we may have biased interpretation of our current situation. The biased interpretation can make our difficulty seem much worse than reality without our notice. CBT helps us to correct misinterpretations. So many friends ask me, what does CBT treatment look like? Cognitive behavior therapy is different from many other types of psychotherapies because CBT sessions have structure, a clearly defined structure. At the beginning of therapy, the patient meets the therapist to describe specific problems and to set goals he or she wants to work towards. The problem may be troublesome symptoms that he or she feels cause depression, such as sleeping badly or not being able to socialize with friends, difficulty concentrating on reading or work, being unhappy at work, or having trouble dealing with a teenager child, or being in an unhappy marriage, so on and so forth. These problems and goals then become the basis for planning the content of sessions and discussing how to deal with them. Typically, at the beginning of a session, the patient and therapist will jointly decide on the main topics they want to work on within this week. They will also together discuss the conclusion from last session. They will look at the progress of last session along with the homework that the patient set for him or herself last time. Check the homework. The goal is to train the patient to detect his or her automatic thought. Those automatic thought is not so realistic and is hurting his or her behavior and normal daily life. So the goal here is to train him or her to detect those unconscious thoughts. Doing homework. Working on homework between sessions is a vital part of the progress. For example, at the start of therapy, the therapist may ask the patient to keep a diary of any incident that provokes feeling of anxiety or depression. Write them down on a notebook. Try to catch it. Try to catch those unconscious negative thoughts. The first step is to detect those thoughts. Then patient and therapist together can examine negative thoughts surrounding the incident and examine them. What does that mean? Is the thought a fact? Is the thought not biased? How much possibility is the thought part of truth? So one thing to emphasize is the importance of the structure in CBT. The reason for having this structure is that it is effective to build up new way of thinking. It will also make sure that important information isn't missed out. For example, we don't want to miss out the results of the homework. The therapist takes active role in structuring the session to begin with. As progress is made, the therapist will gradually hand over the control to the patient, and the patient understands the principle gradually, takes more and more responsibility for the content of subsequent sessions. By the end, the patient feels more empowered to continue working independently. So overall, the first step is to detect the negative thought. The second step is to challenge the negative thought. Is that true? Is that reality? Is that a fact? How much fact does it include? So this detection and challenge will eventually become a habit. So the end goal of CBT is to establish a realistic thinking, to rebuild our pattern of thinking about bad things, thinking about emotional problems. So this is for CBT. Thanks for watching my video. If you like my video, please subscribe to the icon on the right. Your subscription can help other people in need. Thank you. Bye-bye.